Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're going to show you a procedure called Vaser Liposuction, of course one of my absolute favorite procedures. And we're going to be doing this procedure on a really lovely young girl who is very athletic, extremely active, but just is stuck with sort of this hereditary little pouch in her lower belly that's just not budging despite whatever she does. She eats healthy, she takes good care of herself, she is constantly on the move, and this is just a stubborn area that's just not budging. She has actually tried cool sculpting in the past. She has tried 2 cycles at a different practice and it did not do anything for her. So she just wants to get rid of it, and we decided to go forward with Vaser Liposuction. The first step in the procedure is me numbing the skin. So I'm using a little bit of local anesthetic at the initial puncture site. And then I'm placing a cannula that has tiny little holes on all sides that disperses the numbing medicine all throughout underneath the skin. And the cannula does look long, it does look a little bit scary, but it's really not at all, and it's blunt and you can't feel it. And the length is really only there so that we can access further out areas without having to make multiple punctures. So in this step, I'm now using the Vaser cannula, which is again blunt, and it emits an ultrasound frequency that helps to selectively target and kill the fat cells. So it just liquefies the fat cells, but it spares the nerves, it spares the blood vessels. So as you can see, all that beautiful fat is just spilling out. And now I'm on to the step after the fat has been liquefied of actually removing it with a cannula. And again, these cannulas look a bit scary, but you can't feel them at all once the skin is numb. And you can see all that nice fat coming out. Again, fairly avascular. There's really not much bleeding at all. And it's just that nice fatty tissue that has been liquefied coming out. So very not much trauma at all with this type of a process compared to traditional lipo. Patients are very comfortable, and you can already see how that stomach is shrinking right in, just sinking back down. All that fat is going away, and I see that immediate improvement. And here we are with more of the fat going into the canisters. You can see beautiful amount of fat coming out. Here are some pictures of the patient before and immediately post treatment, and she will of course continue to see more and more improvement as time goes on.